So CheckMate-227 is a large randomized phase 3 study with multiple cohorts of patients looking at patients with PD-L1 over 1% versus negative patient population. TMB based on a tissue TMB analysis was added as a potential biomarker to be evaluated. The treatment arms for the study, depending on whether patients have PD-L1 positive or negative tumors, include combination of ipilimumab plus nivolumab, nivo plus chemo versus chemo for PD-L1 negatives, and then nivo versus chemo alone for PD-L1 over 1%. So a complicated design to start with. We do not have the final results of the study, although today, as you and I are speaking, there was a press release by the company suggesting that there might be an overall survival advantage with a combination of Ipi plus Nivo for patients with PD-L1 over 1%. So we have to wait and see the full analysis for that before we can really talk about the data and put it in a clinical context. As it's been reported so far, progression-free survival in patients with TMB higher than 10 mutations per megabase, or 10 or higher, I should say, seem to benefit in terms of PFS from the combination of Ipi-Nivo compared to chemo alone. But up to now, we have not seen the actual overall survival data from this analysis. Therefore, I think we should wait until the full data set has been presented and published so that we can decide how to use this data in our everyday clinical practice. But the design of the study is such that if positive, then one can envision, again, an option for a chemo-sparing regimen using nivolumab plus ipilimumab. So I think we should just wait and see what the results really show.